Welcome to Savitri Dental College Lecture Cast in Prosthodontics, Jaw Relation Part 6, Centric Relation. Centric relation is defined as the maxillomandibular relationship in which the condyles articulate with the thinnest avascular portion of the respective discs, with the complex and an anterior-superior relationship to the posterior slopes of the articular eminence. This portion is independent of tooth contact and it is clinically discernible when the mandible is directed posteriorly and superiorly, and the movement is limited to a rotary movement around a true hinge axis. This is a very important definition and you should know it thoroughly for the exam. So while recording, before I go into that, before the definition of centric relation was called the rump position, which was the rearmost, uppermost, midmost position, but now this is not accepted and the previous definition I said is the most accepted definition. So the next thing we need to learn about is the difficulties in retruding the mandible. So the difficulties could be anatomical, biological or psychological. Anatomical could be arthritis, any kind of joint pathology, subluxation, etc. Biological would be again arthritis and having a physiological difficulty, like say for example inadequate fluids or the disc is damaged, etc. And psychological would be the patient is tense and the muscle contraction is not allowing for proper relaxation and the return of the mandible to the centric relation position. So there are the techniques of recording centric relation can be broadly classified into 4 categories. First is the physiological or static, functional, graphic and radiographic methods. In physiological techniques there are 2 types, namely pressure and pressureless technique. When you are recording the centric relation in pressure technique, the patient will have to apply pressure and bite into the jaw relation. This is most commonly used for removable partial dentures. While we take a bite, we ask the patient to bite into the occlusal rim. So the pressureless technique is most commonly followed for recording the centric relation in edentulous patients. This is what we follow in our college as well. So once the occlusal rims are customized and placed in the patient's mouth, we should mark the midline and the canine lines and orient them outside the mouth. Now we should, there should be even contact with these rims. Next we should make markings for nicks and notches to record the centric relation. So a nick would be a half cut triangle, whereas a notch would be a full cut triangular gutter across the width of the occlusal rim. Here you can see that the posterior is the notch and the anterior is the nick. And then trough is a rectangular cutout again across the entire width of the occlusal rim. Again we should check if the nick and notch and the trough are all aligned together. Next we should load some form of intraocclusal record material. I personally like zinc oxide eugenol, but putty is less messy and it's easy to use. So once the material is loaded, we should again direct the patient or guide the patient to go into centric relation position. So while guiding the patient, we can use your forefinger and thumb on the occlusal rim and the other fingers under the chin to hold the lower denture base with the jaw. The excess material should be pushed into the nicks and notches, and once it's set, we should take it out and we should cut out all the excess. And this is necessary so that while we reseat it, there is no interference or hindrance to record the jaw relation. So once we reseat, again we should ask the patient to open and close until we feel that the centric relation is not shifting and there is a proper rotational movement. So that completes the record for pressureless method of recording centric relation. So remember that the technique is called pressureless, whereas the indexing technique is the nick and notch. And we can use stapler pin or any other forms of indexing for pressureless method as well. So next is functional methods of recording centric. There are 2 methods, namely the Needlehouse and the Patterson method. In Needlehouse method, as shown in the figure below, 4 metal pins will be attached to occlusal rims made of impression compound. And then we'll ask the patient to go forward, backward, right and left, and you will see the 4 markings made on the lower occlusal rim. Whereas in Patterson's method, what we will do is in the lower occlusal rim, we'll mix plaster and carborundum and pumice together and load it into the occlusal rim, and the patient will be asked to make movements. So basically the patient will grind into the occlusal rim to get the exact contour for the occlusal rim and the jaw relation position as well. So the next method is the graphic method of recording jaw relation. Here we will use what is called as a central bearing device. So it involves a central bearing plate which is attached to the upper process usually, and the central bearing pin which is usually attached to the lower denture base, temporary denture base. And then we should ask the patient to make multiple movements, like again forward, backward, right and left. The point at which all the movements converge is called the centric relation position. And as you can see here, you get an arrow point tracing, and the tip of the arrow point is the centric relation position. This point should be again rechecked, and at this position we will inject an intraocclusal record material and remove the upper and lower together and use it for articulation. And remember that the maxillary cast should have been articulated after the face bow transfer, whereas mandibular cast will be only articulated after centric relation. You can do vertical dimension first and then do orientation jaw relation, or customize the occlusal rim, do the orientation jaw relation, and then adjust the lower occlusal rim to get to proper vertical dimension. The next method of recording centric relation is the radiographic method. We usually use a cephalometric tracing to locate the head of the condyle. So basically you insert the occlusal rims, ask the patient to go for a radiograph and check if the condyles are properly seated. The other methods of recording jaw relation would include using a cellophane strip and asking the patient to bite into it and then pulling it out. So by the resistance, it will create the mandible move posteriorly and you will get a very good jaw relation. We can also use cones of wax instead of wax occlusal rim to record jaw relation. So that covers the methods of recording centric relation. This is a very important essay, and I hope this video helps you study it.